Okay, so today we are going to microneedle Jen. We're going to use her own platelet-rich plasma this morning rather than using HA. The benefit of this is the addition of growth factors and really promoting the production of new collagen and elastin in her skin, which is why this treatment is also referred to as collagen induction therapy. So to begin the process, we applied BLT cream to Jennifer's face. It stands for beta-caine, tetracaine, and lidocaine. It's basically to numb her face so she will be comfortable during the treatment. It really is not a painful treatment, even though you might have seen in some cases it looked kind of gory or might have looked like it was painful. It really isn't. The gun is kind of like a tattoo gun, so there are vibrations, but not pain generally. And also we can adjust the depth of the needles to the area on the face and according to your comfort level. And generally we start at a lesser depth and work our way up with each treatment. So for Jen's forehead, we're going to start at a 0 or a 0.1. I always start at the forehead just because you want to start at the most painful area, or what would be the most painful area had she not been anesthetized, but you want to do it before any of the numbing effects wear off. So we'll start with her forehead, and then the nose is pretty much the same. It also has that kind of added strange tickling feeling, but it's fairly quick. For the chin and above the lip is usually about a 0.5. The cheeks are a thicker skin, so we can go up to 1 millimeter depth, possibly higher if there's significant scarring from acne. And then going forward, we would do any additional scars by stamping with a 2 millimeter depth. Now, Jen still has really good skin. We love doing this treatment after the summer just because being in San Diego, we are beach babies and we tend to be kind of subjected to hyperpigmentation and maybe dehydration of our skin. So now in September, it's nice to kind of get a little makeover, and this is an amazing treatment for cell turnover. So kind of give you that new fall skin that you want. Another benefit of this treatment is that it is effective on all skin types, no matter what Fitzpatrick, and you don't run the risk, as you do with lasers, of hyperpigmenting your skin or hypopigmenting your skin. This just really is the best treatment for any kind of scarring. You can do your hands if there are any hyperpigmented spots, or if you're just having kind of a thicker skin, just some textural issues. It also is great for stretch marks or surgery scars. PRP therapy is actually originally emerged for regenerative therapy for sports injuries and different musculoskeletal conditions, and then as recently as I believe it was 2009, they started to use it for cosmetic tissue repair, and it's just kind of blown up ever since. We actually still use PRP in the clinic for pain injections. Jennifer, we injected her shoulder. She's frozen shoulder and has experienced relief and more mobility. Already, I was treated for carpal tunnel, and it has not come back, so it was an amazing non-surgical option. PRP is also used in sexual function for males with Pyrenees. It can increase the blood flow and break up the scar tissue and help with resolving ED. This is called the P shot in most clinics. The O shot would be the female counterpart. It can aid in blood flow and also help with bladder retention. Okay, so pre and post care. Before your treatment, you really aren't very limited, but you do want to make sure that you don't take any NSAID pain relievers. They can they can inhibit the effect of the PRP by reducing platelet function. You also want to make sure that they avoid alcohol, something omegas like chia seeds, just because you want to avoid excessive bruising. It's very unlikely to bruise during this treatment unless you add PRP injections along with the microneedling. This would be done after the microneedling process and would generally be done in the nasolabial folds or in the tear troughs. The reason we would inject it into a tear trough area or under the eye would be to improve the circulation, and it can sometimes make or diminish dark circles under your eyes, and definitely help the regeneration of tissue, so that you, if any of that tissue has been lost or there's not any sunken effect. For the nasolabial folds, kind of any wrinkle is basically a scar, and so it's going to break that scar up, but it also increase blood flow. Another benefit of injecting in fine lines and wrinkles or the nasolabial folds is almost a filler effect. When we inject the PRP, it's activated by local thrombin, which allows the formation of a kind of a platelet gel. Some people even mix PRP with fillers that are made from hyaluronic acid. This full treatment would be called a PRP facelift. And post-treatment, I generally try to schedule appointments in the afternoon, just because after your treatment you don't want to be exposed to the sun, just because you're basically have a micro wound on your face and you don't want to leave yourself susceptible. You also want to try to limit your exposure to bacteria, so no working out that day. Generally, I suggest that they go straight home. You want to leave the PRP on your skin as long as you can really stand it. Sometimes it dries like a face mask and it'll start to peel a little bit. So if that starts to bother you after about 6 hours, then you can wash your face. We just say don't use anything that has benzoyl peroxide or could be exfoliating. And then you want to make sure that you put a towel over your pillow or use a clean pillowcase, just again for the bacteria. You don't want to be a risk for any kind of infection. The next day you can wake up, wash your face, use your moisturizer, and apply makeup. You don't have to miss any days of work. Generally, in those first couple of days, you might have a little bit of swelling depending how aggressive your treatment is, but every time that I've been treated, I've been able to go to work the next day, and at worst, maybe by day 3, you might have a little bit of peeling, but nothing crazy like a chemical peel, just kind of a little bit of dryness, generally around your mouth or around your nose. By day 4, 5, 6, 7, it just continues to improve. This is when you might get comments saying that your skin looks like it's glowing. You really can tell a difference in the texture and tone of your skin. This continues to improve over the next month, and generally the process is repeated every 4 to 6 weeks, really depending on what your needs are. If you have some deep acne scarring, or if you have significant fine lines and wrinkles that you're wanting to treat, then you want to be pretty aggressive and go every 4 weeks. Maybe